This presentation is an educational video about lower back pain, sponsored by the Griffith Allied Health Clinics, located on level 4 of the G40 building of the Gold Coast campus. This video aims to educate you on where your back pain could be coming from, why it may have occurred, and the latest research for management of lower back pain. Back pain is a complex condition that can originate from many different places. Any structures within the body that have a nerve supply can be a source of pain. This means that your pain could be originating from the bones in your spine, the discs between the bones, the muscles surrounding your spine, the articulations, meaning where the bones meet, or from the nerves themselves. The cause of these structures being irritated can be variable, with stiffness between segments, disc herniation, or nerve root irritation being some common causes. Lower back pain is the most common musculoskeletal condition, with 4 out of every 5 Australians experiencing an episode of low back pain throughout their life. At any one time, there's between 15 and 33% of the population currently experiencing some episode of low back pain. Typically, people with low back pain will have significant improvements of their symptoms and function within the first month of treatment, and further improvements up to 3 months. It's important to recognise that 90% of people that have low back pain will experience this again within their life, highlighting the importance of education about the condition and the formulation of management strategies to reduce the burden on your life. The onset of lower back pain is often cumulative, meaning that there has been repetitive, low-level loading on the tissues of the back, such as frequent bending or lifting. This loading occurs at a level that isn't enough to injure the back, but with repetitive loading over time, the amount needed to affect the back has become less. Many people will remember a specific event right before their back pain commenced that normally wouldn't hurt their back, such as a sneeze, but after long-term loading, this can be enough to aggravate the tissue. Back pain can also occur after a single significant event, where the loading on the spine is greater than what would normally occur to those tissues. Examples of this could include falling from a ladder, a car accident, or twisting while lifting something heavy. Recently, there has been a major review of all clinical guidelines available to health practitioners for the non-invasive management of low back pain. During the review, the authors found 10 high-quality sets of guidelines, and there were 5 key management points that all of the guidelines suggested. These included evidence-based education, early return to activity and avoidance of bed rest, paracetamol, anti-inflammatories or muscle relaxants if indicated, and spinal mobilizations. Out of the 5 key management points for low back pain, physiotherapy is involved in 3. These interventions include education about the causes of low back pain, the physiological processes and contributors to the pain experience, and advice on how to get back to activity. Physiotherapists will assist you in finding a therapeutic window of exercise that's specific for you and your back, depending on how you progress through your recovery. This aims to maximize the amount of healing through the use of movement. One of the key points in management of lower back pain is that prolonged avoidance of movement is detrimental to recovery. In some cases, mobilization of spinal segments will be indicated, and this will be assessed by your physiotherapist with the decision made specifically for your presentation. Other health professionals that are a part of the team to help manage your condition include your GP. GPs must be consulted for any prescription and advice on medications that may or may not be helpful in your specific case. It's also very common for people to have a reduction in mood or have anxiety when they have low back pain and have to change from the lifestyle that they enjoy. Research has shown links between lower moods and an increased pain experience. If you're experiencing any changes in mood or episodes of anxiety, help from psychologists can be very effective as part of your management strategy. The Griffith Health Clinic's team of physiotherapists are experts in assessing, diagnosing and treating musculoskeletal conditions. If you're experiencing lower back pain, please book an appointment to begin the management of your condition. The health clinic team also includes psychologists, so if you're feeling changes in mood or anxiety, please consider the input of other health professionals.